President Mike Pence was in Minnesota today visiting a new testing site that will dramatically expand the state's testing capability. The visit comes amidst a growing frustration with testing. Valley News Team's Joshua Peguero spoke to the vice president of a long care facility who's having issues in Minnesota, but not in North Dakota.
Governor Tim Walz is hoping a partnership with the Mayo Clinic and the University of Minnesota will expand the state's testing from 2,000 to 20,000 tests per day. Vice President Mike Pence was in Rochester touring the site of these new tests.
The best way to hasten the day that we can reopen Minnesota and reopen America is to continue to heed the guidance that you've received from state and local authorities.
The Mayo Clinic partnership is a few weeks away before it gets off the ground, and John Rewer of Eventide says they need testing now.
While I'm optimistic, I'm also a little bit frustrated or nervous, if you will, that we're still talking about something that's weeks out, and our battle is today.
Data shows a large number of the COVID-19 related deaths are in long-term care facilities. Eventide on 8th and Moorhead as of Tuesday has 27 total cases of COVID-19. Eventide says the biggest difference between their North Dakota location and their Moorhead location right behind me is that in Minnesota, they're only testing individuals who are showing COVID-19-like symptoms.
They're only able to test on symptomatic residents and staff, and we need to do better than that. We need to know who the carriers are that aren't showing symptoms.
Wewer says North Dakota has been amazing in expanding its testing capabilities for their Fargo and West Fargo locations.
I do think it's a unique approach that North Dakota is using with the widespread testing.
Wewer says these have been tough times for his staff, but they've stepped up to the plate and are working despite the health risks. In Moorhead, Joshua Peguero, Valley News Live.
At the moment, Minnesota ranks among the lowest in the country per capita testing and among the lowest on confirmed cases per capita.